Welcome back to the morning show presented by the PIC Center, and our first guest this Monday morning is Dr. Pamela Hackert from the Health Department. Good morning, how are you?
Good morning, it's great to see you. I feel like you're family now.
I know. We were just showing kind of some pictures of people from Michigan going to Ohio, and so other states are starting to open up, and we're in our final week of the closure.
Is it already next week?
Or next week, next week.
Wow.
What should we be thinking about?
So I did actually do some reading this weekend in particular for that, and I came across one of my favorite authors. His name is Dr. Atul Gawande. I don't know if you've heard of him. Have you heard of him?
I have, yeah.
Yeah, he writes great books. So he's a surgeon in Massachusetts right now, but he grew up in Albion County, Ohio, which is like half the size of Jackson County. It is home to a large university that shall go unnamed, but nonetheless, he grew up in a small town, and I think it's kind of nice to follow what he's doing. And so he talked about in an article last week on the 13th, outlining a 4-part strategy for opening up states and how to keep people safe. And what he's doing is using the things they've learned in the hospital. Massachusetts General Hospital system is like 75,000 people work there, so it's huge. And they have lessons learned. And I know a lot of these things that he goes over. He talks about hygiene measures, screening, distancing, and masks. A lot of these things are things we've talked about, but I think there's a few extra things we could add.
So the masks, that's one thing that's just constantly going to be in the news going forward, and we're seeing more and more people wear them, but we're also seeing more and more people out that aren't wearing them. Let's just talk about that balance again. I mean, obviously we're hearing everyone needs to wear a mask, but how should we treat people who aren't wearing a mask?
So I think it's good to keep in mind those 4 points that he had and kind of go through it in more of a logical order, because they all do play together. Like each one, if you just talk about one thing, it has its own flaws, but when you put them together, they have a really great synergy, like they add up to more than what any of them could add up to by itself. And so if we talked about first the hygiene thing, I think that's important to add. So is that okay?
Sure. Mm-hmm.
Okay. So everyone knows about the 20-second hand wash, and they've actually looked at that, and people are really washing their hands longer. No more of that little like running it through the fingers. So what they haven't though been talking about is how frequent to wash your hands. And
have you been washing your hands more?
I have.
I have.
Yeah. And so I really try and bring your listeners like medical-based suggestions and medical evidence-based suggestions. And this one is based on a study done in Marine boot camp recruits. And they found that when they insisted that they all wash their hands 5 times a day, which seems like a pretty low bar, it actually reduced the respiratory infections by half, 45%. And so I thought that was like a really good message. And we have talked about before, like not wearing gloves when you're out, because that tracks germs and it makes you almost overconfident. But to wash your hands or sanitize your hands before you go in to protect others, and then when you come out to protect yourself. And so this is SARS-2, it's COVID. The disease itself is COVID-19, but the virus is called SARS-CoV-2 because it has some similarities to the first SARS in 2002, 2003. So with the first SARS, they found that they did a study where you washed your hands 10 times a day compared to 5, and that was also much more effective. So if you go places, if you do things, you wash your hands immediately when you come in to your home, you wash them just before you go out. That's 5 times a day doing it twice. So I think that's reasonable. And then so if we talk about like social distancing then, we talked about last week how it went farther than 6 feet. And so you do get that 6 feet if someone's coughing or sneezing. Well, what about the things we do in real life? You know, like if you're at a restaurant and it's loud because they're playing loud music, you have to talk louder. That actually increases your risk of spreading it to your friends, like who you're with. Singing does it as well. Do you remember that with the church choir group? They had the final results on who got sick out of that. It was, just for your viewers who may not remember that or weren't watching, it was in March, before Washington State did their lockdown, but we all knew about coronavirus coming. So they tested everybody with temperature checks, symptom checks. No one was sick at all. They social distanced, they're 6 feet. They did everything right. They didn't hug, they didn't, shake hands, but they all sang their hearts out in this choir practice. And out of the 60 people there, 32 actually came down with COVID. And it was from one asymptomatic person.
Well, and those people, besides singing loudly, they were probably on top of one another too.
No, they weren't.
They weren't?
No, they were 6 feet apart. That's what's crazy. So it's really, those are the kind of things that I don't think are being talked about very much when you hear about reopening. Like, maybe we want to not sing, maybe do instruments in church gatherings more for a while there's still COVID spreading around. Relish your friends who are softer speakers, because the loud speakers, how we've all been like laughing and someone like ugh.
I think when you look at some of the videos of restaurants that have been opened, they sounded loud and boisterous. They sounded normal.
Everyone's happy, and when you're happy, you're trying to listen to music, talk to your friends, talk over other people, and so I think if we remind ourselves to try and keep our voices down a little bit, that will help not spread the droplets.
So that's hand washing, social distancing, then screening. That's one of the four.
Yeah, screening. So if you have been working during this pandemic, I don't know, have you guys been screening here before you start with the temperatures?
No.
Not with the temperature, no.
Okay, so most people can tell if they're sick, if they start to feel it with the temperature, but some people don't. If you've been working during the pandemic, or if you're a healthcare worker, you have been screened. But this is something you will see probably more often. There's talk of screening in restaurants before people go in, certainly before you get a haircut or have a massage type of thing, if you are so lucky, once a year. So that you'll find. And so the symptoms are really important, almost more so than temperature, because more than half of the people don't have temperatures or fevers when they first get sick. It's more mild symptoms, and you have to. And
the asymptomatic people won't show any high temperature, will they?
Exactly. No, and that's also different than COVID. With the first SARS, people actually weren't infectious until about day 5 of symptoms. So you had time to see the symptoms, put them in isolation, which is why with that first SARS, they didn't shut down the world. This is different. This one is where you are asymptomatic before, and the most symptomatic you are is that first day when you may have just a backache, just a headache, little runny nose, those very mild symptoms. And so I think it should become like the new normal. It's going to be like a 180-degree change. Remember, like a long time ago, people had sick days and they stayed home when they were sick, and then everyone had personal time, that's sick days and vacation days together. So if you didn't use your sick days, you got to take it as vacation time. Well, now you really need to protect everybody else, stay home if you have any symptoms and get tested.
We've got some viewer questions for Dr. Pamela Hackert. More of the morning show when we continue. Stay tuned.
As we work to get through these times together, you may not be thinking about blood donation, but blood is desperately needed now to save lives of people who are sick with a range of serious illnesses. It's easy and safe to give. If you are in good health, please donate. We need heroes now. Visit redcrossblood.org to schedule an appointment.
Come see why Art Main is the #1 choice for service for so many Jackson drivers. At Art Main, you know you're getting quality work and quality technicians at a fair price. That's why so many of our customers come back again and again. Whether it's a simple oil change or full body repair, Art Main makes it easy with our online service scheduling. We can even text to keep you up to date.
Come see why Art Main is the largest express facility in Jackson County.
Budweiser would like to take this time to say thank you to all our frontline and essential workers who are all working hard to keep us safe and our world moving during the COVID-19 pandemic. From everyone at Budweiser, this Bud's for you, and thank you.
During this crisis, while most of us are at home, our doctors, nurses, and hospital workers, our paramedics, police, and firefighters are putting others ahead of themselves. My family and the local owner-operators of Big B Coffee are grateful to you. So show your work ID at a local Big B and get a cup of coffee on us. It's a small thing, but now, more than ever, we want to say thank you.
Community members wanting to encourage patients at Henry Ford Allegiance Health who are diagnosed with or suspected to have COVID-19 are encouraged to use the Well Wishes feature on the health system's website. Share your words of inspiration, and HFAH will display them on the TV monitors in patient rooms. The process is simple, quick, and will help brighten someone's day.
Jackson Public Schools Kindergarten and Young Fives Roundup is underway. During the school closures, you can enroll your student online or call one of the schools to receive assistance for enrollment. Please visit the JPS website, jpsk12.org, for more information. Go Vikings!
We're driven to be the best. We're Jimmy's Towing.
Breaking down is always inconvenient, and you never know when it's going to happen. From lockouts and flat tires to jump starts, Jimmy's Towing is on the job 24/7, 365. For fast response anytime, anywhere, the name to remember is Jimmy's. Save our number in a safe place, and if you're in an accident, request Jimmy's Towing.
We're driven to be the best. We're Jimmy's Towing.
Thanks for joining us today on the morning show with Andy and Bart. Dr. Pamela Hackert is with us. She's an occupational health specialist and preventive medicine specialist at Henry Ford Allegiance Health and the Jackson County Health Department. And we're talking about preventive measures, and one is masks. And before the break, I mentioned we've had some viewer comments and questions, and one viewer wonders if there's a protocol or any guidelines for restaurant workers wearing masks. She said, I've had takeout from places where all are masked and places where no one wears a mask.
So it is better, definitely, to wear a mask. They have guidelines that say, yes, wear a mask. They should be wearing masks. And it would be interesting to ask them why they aren't wearing a mask. And I think that it would be a good time to also talk about like what we're going to do, like if I am to come back, what we're going to do in the next month or two while hopefully this virus really settles down and goes to almost zero in our community. So right now we are doing the social distancing of the 6 feet, and we also have been staying at home, both sets of us staying at home and knowing exactly where we've been and not interacting with people outside of our households. And so the social distancing with this is more reassuring. But once this reopening of society starts, then you have to really combine the social distancing and masks. And so I think for your viewers to wonder, like, well, what's going on then if I'm suggesting you wear a mask and social distance when you're with friends and family for the next, at least month while we try and get this virus out of Michigan, what are we going to do? And so my suggestion is that we either would do it remotely, where we can both talk, as we are now, or we would want to wear a mask, because we would be bringing too many other people into our social network here.
And that applies to everyone as we all get back into some sort of new normal. We'll be exposing ourselves and being exposed to other people just a lot more.
Right, and so I would be very curious if your viewer were to ask the restaurants where they're not wearing masks, why they aren't. Do they feel that they aren't coming within 6 feet of anyone? That may be a factor. But again, that 6 feet we know isn't really accurate, especially if you're trying to speak over like a wind, like if they're delivering something to you and you say, okay, my arm is 3 feet, your arm is 3 feet, that's 6 feet, and we're just exchanging the bag. But if you're talking over a wind or something loud, that louder voice will carry potential respiratory droplets.
You're seeing restaurants, everyone's doing it differently. So if some restaurants you're pulling it up, rolling down the passenger window, and they're setting it in. So is that still should be wearing a mask, like you said, because of the wind, or is that okay?
It really is going to vary a lot.
Right.
I would think it would matter if you don't talk with them at all.
Sure.
That's perfectly safe.
Sure.
On the other side of your car through the window.
Right.
Well, the executive order does specify that workers are to wear a mask.
Right.
And I would say you've seen perhaps on social media someone complaining that such and such restaurant, they weren't wearing a mask, or it's that kind of pressure is going to maybe the financial pressure of that. People might be staying away from your restaurant if your employees aren't wearing masks, or away from your
and
store.
vice versa, to be honest. There's probably a section of the population that doesn't want to dine in like that. Another viewer question is, what can a restaurant do that would make you comfortable? What do you want to see out of a restaurant, the first restaurant you walk into?
Well, I am delighted that spring is coming, and it's supposed to be here now, but I would like to eat outside for the next few months. And I would like to make sure that I'm sitting 6 feet apart. No more of those little closed tables, bistro style. No, I never liked them before, but now I really don't want them. So I would want to have those servers wearing masks. I would probably want to make sure the servers are at least attending to how they're serving the plates. I don't want them, how they sometimes will pick your glass up like this and touch the top of it. It's like, no, thank you. Or go back to straws, this whole no straw thing. Straws are nice, you might want to bring them from home. But really it's wearing the masks that would make me more comfortable.
Yeah, and you see the restaurants are going to have to do, it's going to be incredibly complicated and probably very expensive. Things like the communal pile of coffee stirrers, that's gone. That'll have to,
they all have to be individual. But yeah, so you do want to use some of those. Be aware of when you're opening a communal, or you're opening a coffee stirrer, to make sure that you have, just sanitize your own hands, but that might still be potentially infected. You take the paper off, kind of put it in there with the paper still on the other end. Clean your hand. The more you clean your hands, the less likely you're going to get it. But it's not that common to get it off of surfaces either.
And does it matter what kind of or type of mask that people, either in the restaurant industry or overall in general, should be wearing?
Really, the most important thing is to make sure you get a good fit around your sides of your mouth and not gaping at the bottom or on the sides. I mean, I don't really enjoy wearing masks. I don't think I look very good in masks, but and it's just, so I'm going to be wearing my mask. I do wear my mask out all the time, and though that's really most important, also to not touch the outside of your mask when you're taking it off. So if you wash it, that's that's important every time you take it off. It's not going to shake the viruses off. One thing I thought was really interesting was that this virus is pretty, if it's going to be spread by air, it's like that's one of the things you don't have to worry about as much. At first we were wondering, like, the virus that hangs around in the air and that cloud we saw last week, how much do you have to worry about that? And it's really not too much, because it said it's pretty slow moving, and we move too slow. We move the air out of our pathway when we walk. Oh, that was very cool. And so it tends to make the virus go around us, but respiratory droplets will come right at you.
If we do all these things, when can we see our family and friends? It seems like not everyone, but the majority of people are willing to accept all of these things if we're out and about and getting to see our friends and family and getting back to some normalcy.
Yeah.
I know you cannot tell us exactly when, but are we close?
Are we close to getting back to
being able to see family and friends?
Oh, yeah.
and then
we are.
Yeah.
And so I think that we still want to remember that we're getting about 100,000 new cases a day.
Right.
And Jackson County has never been a hot spot, despite what those predictions had said. We have done a remarkable job not spreading it. And so what people are doing right now has been very, very well done. But when you have friends and family over, probably better not to share too many meals with them or eat outside and eat separately. But other than that, you actually want, just like I'm saying with you, like we want to keep our 6-foot distance, and you actually do want to wear a mask while you're with friends and family for the next probably month and a half, I would guess.
See, we're seeing pools starting to open up, residential pools. What about pools, and then what about public pools?
So, good question. Public pools, you would still want to make sure you do the 6 feet apart, which is a little harder, but that again is for the breathing. It's for trying to make people distance enough so they're not breathing or getting respiratory droplets on you. Little kids bounce out of the water and sort of spew everything. So that's a concern. But the virus is killed by chlorine. So private pools that are well chlorinated, to the correct level. You don't want too much, you don't want too little. Those should be safe. The only concern there would be the common surfaces. But again,
do you think we'll see public pools open this year?
I think we're going to have to see how our numbers go with the opening of what we are opening and how that works.
And that pool question doesn't apply to lake swimming because there's no chlorine in the lake.
Right.
Can the virus be transmitted through water?
Not that I have ever seen. I have not seen that. I think it would be too dilute.
We have another viewer question about the numbers. The viewer asks, I've been looking everywhere and can't find it. Can you tell me if there is anybody tracking how many of the cases and deaths are essential workers versus those that were working from home or not, going to work?
Well, 2 points about that. We know that in the hot spots like New York City, that essential, the healthcare workers, not all the essential workers, but healthcare workers were about 18%. That was high, but I think that was because they were so early that they didn't have the knowledge of things like this is infectious before you have any symptoms and those kind of things. The numbers are much lower now. I think healthcare workers are down to less than 8%. But you also hear the stories where one company is tracking their workers and illnesses, and then they respond to it, which is good that they're responding appropriately. So clearly it would be higher. Are they tracking it specifically? No, they are not, because they still have that uncertainty of if someone is staying home, are they really staying home and not going anywhere? Or did they go to a grocery store without a mask and just say they were home? And then a second point to go with that on the other side is that a lot of these cases are coming up in people who have only stayed home. They just report they've only stayed home. And that's not how viruses work. They don't seep into your home. So they must have gone out somewhere or had contact with someone who had gone out somewhere. So it's not going to ever be something they can actually know for sure. That one plant, did you hear about that one plant in the East Coast? I don't remember where like 60 workers went in for a month and they lived there in the plant making masks. People are really amazing sometimes. The things they do. And so they stayed in there and they were all healthy when they went in and they were all healthy when they came out. So they slept, worked, ate there, and made masks for the workers.
But I think there is one thing that we do know about Jackson County statistics. As far as positive cases, we've got 415, and we do know that about a third of those are corrections employees, right? Mm-hmm. So at least a third of the case count in Jackson County is essential workers.
True, but they are at a very high risk of essential workers.
Sure.
It's not like the restaurant drive-through workers who would also be deemed essential by the governor's orders.
Yeah, and I've seen actually, those things that you use to grab cans off a tall shelf. I've seen pictures of restaurants using those to deliver the food bag to people in cars.
As things start to open up, people are going to be itching for haircuts, and you're gonna have long lines at some of these places, right? So, what do you recommend for some of these businesses that are in the personal service industry? They're still going to be waiting on the governor for when they can open up, but what should they be doing now just to kind of get ready for that?
You know what I'm seeing, and I think it's almost free to do this. It's probably a very inexpensive app, but to get your business ready to text your patrons so that you can have them check in online or call you or text you to say, we're here and we're in our car, and then you text them when you're ready for them to come in. So people should be waiting in their cars more than waiting in the stores or in line. We can all entertain ourselves in our car now with our phones, and so if you invest in that technology to be able to text people, you can say, you're next in line, come on up to the door, and then either take their temperature, hand sanitize them, make sure they're wearing their masks. And I really would recommend people keep a supply of masks in their cars so you can always switch it out. Because you're not just switching it out for your safety, but you're also helping others. And it's really a very nice win-win situation. It's a way to give back to society that we haven't seen for quite a while.
Some great information, and we appreciate having you be here again. Thank you.
It's lovely to be here in person. I'll miss you when we're doing it video.
From Henry Ford Allegiance Health and the Jackson County Health Department, Dr. Pamela Hackert. Joining us in moments is Phil Tripp from Tripp's Auto Shop and Collision Center on The Morning Show. Stay tuned.